Hi everyone, it's Tammy Sharrow, and I'm going to be talking about school-age children, specifically around experiencing behavioral problems and mental health concerns. And we're going to really dial into attention deficit hyperactivity disorder. Many of you working in the school setting will have been working with kids with ADHD. So our objectives are: what are the most common behavioral and mental health issues that occur in children? What is ADHD? How does it affect the child and the family? We're going to describe and discuss some effective strategies for supporting these children. And what are the key nursing interventions to support them and their families when they present with a behavioral and mental health concern. We'll talk a little bit about assessment, getting diagnosed, and then treatment. So mental health describes not a single disease, but really a very broad classification for many problems that can affect thought, emotion, and really just this ability to deal with the stresses and strains of everyday life that a child without a mental health issue would have no problem with. And so the tricky part is that mental health disorders are often viewed as invisible, only seen from the inside. And so there's a lot of sort of misconceptions or myths that go along with mental health disorders. It's not like coming to school with a cast on your leg and all the kids want to sign it. Coming to school with depression, everybody wants to run the other direction. So ADHD, the key clinical features relate to three sort of specific areas. And ADHD interferes with the child's ability to regulate their activity level, which relates to hyperactivity, to inhibit their behavior. So they often have impulsivity, and their ability to attend to the task at hand, or inattention. So what this might look like as far as inattention would be having problems focusing on details or making careless mistakes, having difficulty following through on instructions, specifically verbal instructions, finding it challenging to be organized. They might avoid tasks that require sustained sort of mental concentration. They often are losing needed items. They can become easily distracted and can be forgetful in sort of activities of daily living. Regarding hyperactivity, impulsivity, these children often fidget a lot. They have difficulty remaining seated. They might, be more physically active, running, climbing excessively, having trouble remaining quiet. So in class, they're maybe louder and more disruptive. They might talk excessively. They might not want to wait to put their hand up, so they're just blurting out answers. Having difficulty taking turns and interrupting others or kind of being intrusive. So the prevalence is estimated at 6 to 9% of children. Boys are affected 3 to 4 times more than girls. But one of the things that recent research has shown is that girls are often underdiagnosed. So whether that's totally accurate or not. And then ADHD symptoms really can occur on a continuum. You can have a child with mild ADHD to a child that has, quite severe ADHD, and it really is compromising their life in many different ways. So ADHD rarely occurs in isolation or by itself. Children or people with ADHD often have other types of coexisting mental health problems. You might see oppositional defiant disorder. You might see some aggression, anxiety. They can have depression. Pardon me, just having a drink. And then they can have learning disabilities. Common is reading disability or dyslexia, or writing disability or dysgraphia. And often they might have language impairments or a speech delay. So, we say talk by 2, understand me by 3. My son had mild ADHD and he had a speech delay, and certainly had some dyslexia and dysgraphia. So how does ADHD impact the child? Unless it's really identified and properly treated, children with ADHD are often at higher risk for school failure. They struggle to succeed in school. They can experience depression or anxiety. They might have low self-esteem, and that sometimes can be due to problems with relationships. They have trouble getting along with their parents. They might have peer relationships. Teachers might find them a difficult student to have in their class. And some of the long-term issues can be substance abuse. There's certainly a higher incidence of that in people with ADHD, getting into trouble, delinquency, risk for accidental injury. A lot of time their impulsivity, they can be risk takers, they can, end up, injuring themselves way more commonly, and then trouble to succeed in a job or a career. So this was a really interesting study. It's a little bit of an older study now, but it was a study where they interviewed college students who were receiving support through accessibility about their experience growing up with ADHD. And some of the things that they reported were feelings of sadness, anger, and frustration. So they had a lot of trouble getting along, specifically with their parents. They always felt different than other children, their peers. They sometimes felt misunderstood, and they missed a lot of stuff in relation to school. So, being able to absorb things within a classroom setting, to be able to get their homework organized, to go home, to complete their homework, to bring it back to school, losing focus in class, those kinds of things. So what is it like to have ADHD from the child's perspective? Well, this is a picture, a self-portrait by a child. And I think you can see just on first glance there's a lot of really vivid, high energy, bold colors, and there's a lot of sort of chaos going on, a lot of moving parts, a lot of energy. I'm thinking the little triangular thing is probably their head. I see maybe a couple eyes, nose, mouth, and this is sort of their lived experience. Some of the strengths of kids with ADHD are certainly the top two kind of go together, out of the box thinking. So they tend not to be traditional learners. They are very kinesthetic learners. They learn best by doing. They learn with their hands. They don't learn by sitting still, being quiet. So many of the things we ask kids to do in school are really difficult for a kid with ADHD. Line up, sit still, be quiet. Where these kids are often highly, highly creative. They're adventurous, they're intelligent, and when they get the proper resources and treatment that they need, they can truly let their individual intelligence and personality shine through. Great problem solvers, and as I mentioned, they're willing to take risks. They might be a child who might take on higher risk sport, for example. So what is it like for parents? Some of the parent experience, parents can often experience frustration in how best to handle their child, especially before they get diagnosed. They might experience anger. They might be sad or have sorrow in relation to, the challenges their child is facing, or they might have a sense of failure as a parent. So some of the parent quotes are, "It's like he's in a three-ring circus trying to juggle five things, and he can't juggle." In kindergarten, he cried a lot and was very sad and felt like he couldn't do things to the expectations of teachers and parents. Society is so judgmental. People say, how do you know it's truly a syndrome or a disease? Even I thought I was crazy. And I can remember my son got diagnosed in grade 5, and he was the kid who was always blurting out in class, could never follow verbal instructions. We were going back to the school countless times to get the right homework, the right book. I was getting kicked out of the class in the hallway until we really got him diagnosed and sorted out. So I personally, a little self-disclosure, I experienced, a lot of the frustration and sadness. But once we got things sorted, everything was perfect. Watch the movie Struggle for Control. It's a Canadian movie. It is award-winning. It was filmed in Vancouver, and it is about one family, and there are 3 boys who all have ADHD, but it's really focused on David and his struggle for control. It really talks about everything in relation to ADHD, and it's a great summary. So getting there, how and when is this diagnosed? Well, typically it starts by parents and teachers noticing challenges that the child is facing. And often, they then would seek out, the parents would seek out the family doctor or pediatrician. I remember the teacher saying that my son needed his hearing tested because kids with ADHD often don't appear to be listening, or they're distracted and they're not hearing. And so commonly it's a visit to the family doctor or pediatrician to examine the child for physical causes, things like sight, hearing, speech problems, look for any other comorbidity, any other underlying problem. They might go to see a psychiatrist to work with the child to assess things like physical, emotional, or social problems. They'll often see a psychologist. The psychologist might examine the family environment and relationships, and then teachers are usually involved. And what typically these children undergo is a psychoeducational assessment, typically by a master's or PhD prepared educational psychologist, and they test the child's IQ, they examine the child's academic abilities, and they look at how they learn, how they would learn best, where their learning challenges are, and how they can best be supported in the school setting. And so often what comes along with that psychoed assessment is the child receives a code, and that code can dictate the amount of support the child receives in school, such as simple things like extra time on tests, as just a simple example. So the best treatment for ADHD is usually a combination of behavioral treatment or behavioral therapy and medication. So what the research shows is that for short-term results, medication is better than behavioral therapy, but long-term, the combination works best. And one of the questions is, do you outgrow ADHD? No, you don't outgrow it, but you typically learn how to manage it and you have the support and treatment in place to be able to excel. So when we look at behavioral therapy or behavioral management, what might be some of the modifications that parents can make at home? Well, a lot of times the child struggles with, getting the right homework, bringing it home, completing homework, completing tasks at home, being organized, those sorts of things. So some of the best things for parents is to provide a structured routine or system. Routines can really help to be able to provide behavioral cues to the child when they're getting off track, or they've lost their way, they're getting distracted. So a behavioral cue might be a tap on the shoulder, a reminder of some sort to bring them back into focus. Environmental changes. So how can you decrease distractions so your child can, say, accomplish their homework? Are they trying to do it in front of the TV in a busy space where there's lots of movement and noise, or is there a quiet space they can go to and get little timed segments? Bringing inappropriate behavior to attention respectfully, having consistent, realistic expectations, and making those clear. The family in the video used a reward system, or they had different jobs they needed to do. They had a checklist or a reward checklist, and there was rewards when you accomplished them, but consequences if you didn't. School specific, some of the things that we think about is having these kids sit in front of the class. There's nothing worse than being at the back of the class and looking through 30 other students that are all moving and fidgeting and chatting and whatever. So sitting at the front of the class, pardon me, the teacher providing them with visual cues or reminders, or those behavioral cues, might be a tap on the shoulder, tap on the desk, kind of bringing them back into focus. Providing the child with verbal and written instructions. One of the things that worked really well for my son was having a check-in and check-out at school. So at checkout of school was like, do you have everything you need to complete your homework? Do you have your homework written down? Do you have the right textbooks, the right binders, whatever? And then coming back in the morning, having a check-in. Did you complete your homework? Did you have everything you need? And that process helped the child learn as well, that process, so they could, apply it on their own. A lot of times, kids with ADHD, if they have accompanying dysgraphia, are way, way better at keyboarding than at printing and writing. Sometimes their writing skills can be cumbersome. They just don't have that fine motor. And so getting them a laptop, computer, iPad, something like that can be really effective. Active learning, or I mentioned kinesthetic learning. So they're not the kid that can sit still for hours and hours on end. Building on their strengths, and certainly getting them assessed, getting them coded, and getting them the extra help or resources. So just a little brief discussion about medication. ADHD meds are stimulant medications, and a lot of people say, well, why would you give a child that's already hyperactive and impulsive a stimulant medication? But the movie describes beautifully why that works, and the medication works by stimulating underactive areas of the brain areas that aren't working at top capacity, that are preventing these kids from being attentive and not hyperactive and impulsive. And so Ritalin is probably the most common. It's been in use since 1954. It has a variety of forms: short acting, intermediate acting, long acting. Um, it works by enhancing catecholamine, so norepinephrine, dopamine effects, improving attention span and task performance. Some of the side effects can impact appetite, so we need to closely monitor weight and height and growth in these kids. It could impact blood pressure, heart rate, and it can have an impact on sleep. So some of these kids might experience insomnia, and it lowers the threshold for seizures. So a child with this seizure disorder, we need to be very cautious about using this particular medication. I'll tell you a little clinical story. My students were working in the school setting in the PACE learning program with a little girl, grade 7, who had quite significant ADHD. And she was really, really thin and skinny and had no appetite. Her family used to make her this beautiful lunch every day, and my students would sit with her and she'd eat like 3 grapes out of it, or half a granola bar. And she really, really struggled with insomnia and would come to school with these huge black circles under her eyes. And it was because my student was looking at her through a nursing lens, not a teacher assistant lens. She spoke with the teacher spoke with the parents, and they agreed, and they actually took the daughter to the doctor and got her meds reassessed, her dosage. So that was just the impact of being in the school, but coming from a different lens than sometimes the teachers do. So in summary, did we meet our objectives? We talked about the most common behavioral mental health issues, what ADHD is. We talked about effective strategies for supporting these kids, how they get diagnosed, and specifically what we can do for them in the school setting or suggest to their parents to really help them cope and really excel and go on to be the great children that they are. Thank you.